Welcome to Living Well Naturally. I'm Dr. Anna Saylor, a KST chiropractor and owner of Anna Every Family Chiropractic Center, located in Royal Oak, Michigan. My patients from 3 hours old to 103 years young all have one thing in common. They want to feel better. Together we will share and explore a healthy lifestyle to help you be the best you possible. It is my goal to provide you with information, insight, experience, and motivation that allow you to feel better and put you on the path to living well naturally. Pain becomes chronic when it lasts long after the initial injury has healed. It may be caused by a disease or it may be the result of an injury. Chronic pain can affect anyone and can occur in almost any part of the body. We are here today to help you find some relief from chronic pain. Joining me are Dr. Marissa Heisel and spiritual healer Sarah Hall. Dr. Marissa, tell me a little bit about you.
Hello.
Yeah.
I am a holistic chiropractor up in Ontario, Canada. My specialty is really with women and children, and my special interest is helping women to find and reclaim all aspects of themselves so that they can feel whole and well once again.
Wonderful. And Sarah?
My name is Sarah Hall, and I am a spiritual therapist. And my own definition of spirituality helps to understand a little bit of what I do. And I like to define spirituality as our relationship with ourselves in very general terms. And what I do is I work with people one-on-one to discover a relationship with their lives that helps them to live their best, most fulfilling experience.
Okay, wonderful. So we're going to talk a little bit more about just chronic pain because we know we all have people that we've dealt with that have been dealing with pain for a really long time. So tell me a few things, like what would you say your number one thing or a couple of your things that you would help with?
So what I always look at first is not just the physical area of pain or even a referral pattern of pain. What I want to know first is what was happening at the time that pain perhaps first started. Is there something that somebody's still carrying with them that's helping to or causing that pain to continue to be perpetuated? And what are the stories that people are now holding on to that might be limiting their ability to move forward into wellness and wholeness once again?
Okay. Like for us as chiropractors, for me as a chiropractor, we want to get to the root of the cause. Like when did it start and why did it start? Sarah, tell me a little bit about what you do for help.
I do much the same thing in that I look for the root cause of it, but I look on a very holistic level. So we work with the emotional cause or maybe some of the underlying beliefs that someone might have that might be causing more stress or really limiting their experiences. And we work to heal it from that end because I really believe that you can approach healing from multiple angles such that you can approach it from a physical healing method and thus help to relieve perhaps the emotional aspects of pain and also approach it from the emotional aspect to heal the physical.
That's fabulous because that's kind of like all of us are kind of in the same path then because we look at it as chiropractors, we're looking, physical, chemical, emotional, and what can we do on all those levels. And I know you do a lot with oils.
I do.
So tell me a little bit about oils for chronic pain.
There are quite a few of them that can be used, both for relieving physical symptoms that people are having, because certainly we don't want to ignore the physical symptoms. That's often what will bring somebody into an office, whether it's a healing practice or a chiropractic practice in the first place. But the other thing that essential oils will do is that they'll work on the emotional and spiritual levels as well. Okay. So they'll get at some of the underpinning of what people are experiencing in order to help them to heal, not just on the physical level, but really get at what's underlying that chronicity, what's holding that pain in place still.
So I guess my question would be, how would an oil do that, though? I guess,
So every essential oil has its own chemical compounds, its own chemical properties, and they all, based on what the compounds are in that particular oil, will affect different physical and emotional aspects of a person's experience. Depending on the oil that you choose, it might help to work with grief or loss or sadness or holding on to anger. And there are a number of different ways to approach that.
Wonderful. And what about you, Sarah?
Something that I like to work with is examining the feelings that are attached to it wholly. So I'm a big believer in embracing your feelings and asking them what message they have for you. I believe that feelings are the way that higher source energy speaks to you clearly, whether people choose to call that God or your higher self or just your inner intuitive wise part of you. our feelings all have a profound purpose in our lives to direct us to the best life that we can be on. So I believe that when we embrace even our painful or uncomfortable feelings in life, we can learn more about ourselves, learn more about our experiences and what is good for us so that we can balance everything. So I work with people to really get into those feelings rather than pushing them down or trying to just get rid of them right away. We embrace them and we ask those feelings to speak to us so that we can bring whatever resolutions those needs are asking for.
Very nice. I know we deal with, I always say it's like women tend to come in the office much more because of thoughts and stress, and we see a lot of emotional pain manifestation in like chronic pain or hip pain or a lot of different things like that. So we're always working on, is it a physical or a chemical or an emotional component to this actual injury state? So.
And I think if you're talking about chronic pain, men have the same experience, but don't necessarily recognize that there is an emotional underpinning to it. They think that, their low back has been hurting them for 5 years. And there's no understanding of how now their belief system around that back pain, or how it's limiting them in their lives, or how it's affecting their relationships, or even their ability to work, might be influencing the way that they're experiencing the pain. But I don't think the emotional component is the same. It might just be the recognition of it that's a little different.
Yeah, I think that's really a beautiful thing to kind of embrace, as you said, for both genders. I think that our consciousness is not just stored up in our brain. I believe that it is all over the body, and that the body remembers the experiences that we have. Our whole, form is sensing and relating with the world around us at all times. And so sometimes that lower back, for example, can be storing up a lot of stress that you'll have aimed at a particular issue. And getting at that is a way that we can really help to unlock and release that and know ourselves better, of course.
So I recently met TJ, who had been living with chronic pain for many years and is trying to stay off pain medicine. So here's a short video about his story.
My name is Anthony Prisendero. I've been working on the assembly line for 20 years in the stamping plant, and my joints have endured a lot of pain. Being on cement, doing the same thing over and over again, repetitiously, can take a toll on your body big time. I had an orthoscopic knee surgery, and I had a radial osteotomy in my wrist because my lunate bone had lost its blood supply from a disease called Kienbach's disease. My shoulders, I had both rotator cuffs redone. And within 1 year, I was on a job hanging fenders, and my left one went out, and I came back and was put on the same job. In within a year, I had surgery on my right one. And my lower back, the laminectomy that I had was without fusion, but now the 2 discs above that discs are bad, and they want to fuse those together. I'm tired of saying ow 10 to 20 times a day. I have been more healthy and changing my diet and trying to get my metabolism up and strengthen my core and keep my mindset on positive healing and doing like yoga and meditation to stay off the narcotics. I don't want to be on the pills, but I'm in such pain daily that I have to take meds, and I don't want to. I've actually had some laser therapy before. I've had acupuncture. If I didn't have to get up and go to physical therapy, which I know is going to make me feel better, and that's why I'm real positive about it, I'd probably stay down. I'm still adjusting to trying to live differently. Just little things that you do in your regular care, health care, that you just think is normal. You like getting out of bed, just getting up, or sitting down. It's you have to live differently. You can't go play with your friends if they want to go play volleyball or anything. It's kind of depressing. I miss being pain-free.
Maybe we could talk about some suggestions that we would give TJ. Obviously, one of my suggestions to him is chiropractic, and we'll talk more about that later. But how about you? What other suggestions would you say for him?
I like a lot of what he's already doing. Mm-hmm. I like the idea of incorporating in different aspects of healing, looking at meditation, looking at yoga, but asking those questions, how do I do things differently in my life? And as he was saying that, it really it clicked for me. It reminded me that that's often, if you want to look at what a message pain might bring, that might be part of the message. How can I do things differently in my life in order to experience a different outcome? I often talk to patients about how our bodies speak to us in whispers for a very long time. And we often can't hear the whispers, or we don't recognize them for what they are until our bodies are screaming. And that's what pain is. And it's a constant scream. It's that constant feedback to our brain, and our brain is constantly giving back a message. And at a certain point, we as chiropractors talk a lot about the body's innate healing ability, the ability of the body to heal itself. But there's also that point that you go beyond, that the body's not doing that anymore. And there's been a lot of time often, as TJ was saying, the same job over and over, that repetitive strain for years, that we need to start looking at, what can I do differently here? How do I experience my life differently to not end up in this place that I'm now stuck in?
Yeah, or choosing to, we say, I choose to work out every morning. I choose to eat healthy. I choose to do the things. I choose to get adjusted. It's choice too. So what would you offer too?
Well, something that is really, really calling to me as I connect with his story is something that I find often with pain in general is that pain is asking you to take a very, very close look at your life, and it's trying to get your attention, as you were saying. It's trying to give you a very strong call saying, what about me? I need to focus some of my attentions back on me. So oftentimes people that will experience things like this can, on an emotional level, be givers. They're constantly doing for other people and spending all of this energy taking care of everything except themselves. And so, as you said, that pain is a message that builds up over time, starting, as you said, as a whisper, and is saying, hey, give me a little bit of attention. I need to start working on focusing on whatever it is that is calling for some, real sustainable self-nurturing. So that's the first place I'd start is what desire, need, or emotional attention is being stuffed down, and how can we start addressing that?
Sarah reminds me of a patient who I've seen a few times, who's a man in his mid-40s, who told me that he's worked the same job since he was 19 years old. His wife got pregnant young, and he went to work in this factory, and he's been in the same place since 19 to 44, and he's hated every single day of it. That's what he said to me. Every single day from 19 to 44, and he has tremendous chronic pain and physical pain. And I thought, but you can't have that kind of despair every single day that you wake up, that you're going back to that job again, and not expect there to be some sort of outcome from it, as well as doing that repetitive, constant task. It's physical work again.
But it sounds like from the get-go, the minute he wakes up, he's dreading going to work.
Right.
And then it's that cycle,
Right.
Yeah.
So how do you break that? I don't even...
I would say it's time to start making some brave decisions for your life and making some big changes. Mm-hmm. And I find that if you're willing to put yourself first, you're sending a very, very strong message to the world that you are relating to every single day. And I know that, for example, changing jobs can be very stressful or scary for some people. But again, if you put yourself first, then the universe or the world around you will start to match that standard that you place in your life, that standard of self-love and self-respect first, and it will catch you. You do that trust fall into the world, and it will catch you and help you to find a lifestyle that can really support you and uplift you and fulfill you as well, help you feel as if you are giving back to the world in a way that makes you delighted and excited to go into work every day, and having that joy and excitement with you, that self-love, love for your own life, is a miraculous healer, I think, for all kinds of pain.
See, and I feel like I've found my calling. Like, I love, every morning I wake up and I love going to work, and like I teach my girls, like, it's not that I have to go to work. It's like, I can't wait to go to work, and I love what I do, and I love helping people. So like, I found mine, and it's like you said, it's like trustful. I love that saying, because it is. It's like you have to trust that the universe is going to open up to what you need at that time too.
Yes.
But how many people don't have that experience?
A lot.
I talk mainly with women, but I talk all the time about needing to find what our passion and our purpose is. And what we thought it was when we were 18 or 19, and then we have children, and now we're in our late 30s, mid 40s, might feel very different. Mm-hmm. And so how do we reclaim that? How do we ignite that spark within us so that we feel that joy, so that every day isn't heavy? There isn't that really heavy energy that then becomes this really heavy physical issue as well. And the two of them are inextricably linked. We can't say that they're not. Louise Hay has been saying this for 30 years at least.
Best book ever.
Right.
Your Body Speaks Your Mind. There's all these, like, you can see almost everything. Like, I look at the tailbone, for instance. every woman that comes in and they have this chronic tailbone issue, it's like, okay, what's going on with your mom or with motherhood? Because it just ties right to that aspect. And so if you don't clear the underlying issue, it's just going to keep coming back. And they're like, I have this constant sciatica or a constant tailbone pain. And it's, okay, what issue is this that you're dealing with?
Right.
Yes, exactly. And I would say for those people that don't have the experience of knowing what their passion is, it kind of goes back to the theme of what we've been talking about, is listening to your feelings. Because as I had stated before, I really think that God, the universe, your higher self, whatever you want to call it, speaks to you every single day through your feelings. So getting in touch with those feelings and learning not to ignore the little whispers is going to lead you to finding your passion. It's constantly communicating with you, and nobody is left out, and every single soul that exists in this world has a profound purpose to complete, no matter how big or small we may think it is. They're all very important, and we all deserve to live them.
Yeah, that's awesome.
What I'll often talk about is not just feelings, because feelings will often have thoughts in them, and we can get confused with feelings and thoughts and misunderstanding what they mean, but talking about awareness. And if we can start with children, teaching them to have greater awareness of themselves, of their surroundings, of the people that they interact with, of everything in their lives, of their families, then you don't miss those little whispers in the body as much. But we need to start with that inner quiet and that listening that's become a bit of a lost art.
Well, yeah, because, okay, technology,
Yeah.
electronics, there's
Yeah.
always something else to get your attention. There's always some kind of noise. There's, it's hard to get past that sometimes too.
Yeah.
So,
Yeah.
it's like you said, the quietness is really meditation, yoga, a lot of the practices that we always are recommending. It's that whole body, mind, spirit connection that a lot of us are missing.
Yeah, I think what both of you are starting to bring up is really beautiful and exciting, because it starts to touch on the idea that as we heal these things as individuals, we're working to heal socially. As a society, I think that a lot of the way that our world is constructed around us makes it very, very difficult to listen to our feelings, to use our thoughts in an empowering way, to have that very present awareness. And as you were saying, we need to start talking to children about this. I think that's amazing, because children are born completely connected to every single one of their feelings. You see a little toddler or a baby, and they have a feeling, there's no filter. It comes right out. They'll say exactly, they'll express exactly what they feel. But in the process of becoming civilized, we learn to stuff things down. So it comes this dance that we do of, learning to grow up and to become, contributing members of our society in such a way that we're actually helping to progressively move it forward, and that we're raising people and, creating communities and families that are based on this higher sensitivity or awareness to the importance of feelings and presence.
Yeah, I love it. We're raising beautiful human beings too,
Yeah.
that are connected. That's
Yes.
the biggest thing, because I think we're losing a lot of the connection. We see teenagers are texting each other in the same room. It's like,
Yes.
okay, really?
Yes.
How do we gain that connection?
Yeah, I think we've lost a lot of that resiliency and awareness that kids used to have. And a lot of that, I think I've mentioned even here before, where I'll see, a mother hand her 8-month-old an iPad to sit there with while I'm adjusting her or while I'm seeing her.
Right.
And so we've lost a lot of that connection to oneself and that connection to nature as well.
Okay. So I want to thank Dr. Marissa Heisel and Sarah Ha for joining us today on our panel. It's time for a quick break, and when we come back, 2 new guests will be here speaking about their journey to living pain-free.
Hey everybody! Heart disease affects 1 in every 3 women in America, but you can fight back. There's no time to lose. Mothers, sisters, daughters, families, and friends, it's time to shout louder, stand stronger, and demand change. Let's go!
To the Batmobile. Dang it.
To the invisible jet!
Dang it.
Together, we can put an end to heart disease. It's time to go red for women. I could use your help. Yeah! Learn more from the American Heart Association at www.goredforwomen.org.
Hart, what's going on?
I'm leaving.
Why? What did I do?
Not enough. The pressure is too much. I quit.
I get it. I can do better. Just please don't leave.
Don't let your heart quit on you. Get your uncontrolled high blood pressure to a healthy range before it's too late.
So welcome back. Joining me on the couch are Donna and TJ. Donna's been a patient of Anna Chiropractic for just about 9 months, and TJ just started getting adjusted about 3 weeks ago. So, Donna, tell me a little bit about you and your history.
It was funny, after you asked me to be on here, my husband and I actually sat down and realized that this has been going on for 30 years. My neck started hurting every day that long ago. I came to you because my niece was bringing her little one for her upper respiratory problems, and it was a miracle for her. So I said, well, maybe I'll try because I can't do regular manipulation anymore. Came to you, and at this stage, I am almost 100% pain-free, which for me is a miracle.
Yeah, 30 years of neck pain.
Yes.
And not just neck pain. I mean,
no, I couldn't wear a seatbelt when I first came to you. I had to hold the seatbelt at the steering wheel so that it wasn't touching any of the front of me because it would cause other symptoms other than just pain. My whole throat and neck and everything would just tighten right up.
I remember we have a sheet of all the symptoms, and you basically gave me and you had almost everything highlighted.
Yes.
You said at one point in your life you've had one of these issues.
Yes. I had a laundry list when I
Yes.
came. Absolutely.
And you're doing awesome now.
Awesome. It's been a miracle. You know, I call you my little angel all the time.
Well, thank you. So we can give TJ hope, right?
Yeah.
Yes,
TJ, you just started
definitely.
here at our office.
And amazing results right off the bat.
Okay, because we saw your story, and
Within the first 2 visits, I actually felt relief and was able to sleep better at night, and noticed that I could have more mobility with movement just getting up in the morning, and makes a big difference. I'm really happy about it.
awesome. I mean, for our viewers, they don't really know what it is that we do or what I do. I do a very specific technique called KST. We focus on a lot of cranial work, so hence why my skull's here. So we're doing a lot of different kind of adjusting because I know both of you had surgeries.
Correct.
Like some pretty big time surgeries.
Correct. We both have the same ones in
The
our
same-
necks.
In the neck, yeah.
And so traditional chiropractic, I know you were scared to death.
Right.
Right?
Yep.
Okay. And so obviously the adjustments that I do are very gentle.
Yes.
Really quick, tell me the story about the moles, because that's fascinating to me.
What's funny is I just went recently to the dermatologist, and she told me that the things I still have a little bit left on my face, but I had them completely across my head. And they're actually skin lesions of some kind, and they are caused by the nerve damage, I guess. Most of them are gone because they came around my face and all the way to my nose, and if you can notice, there's almost nothing left. And these are much lighter and almost gone, and my head is completely cleared just from coming to you.
That's awesome.
That's great.
Because a lot of people think chiropractic and they think like back pain and neck pain, which is obviously some things that we definitely help.
Right.
But we're helping a lot other stuff. And
Right.
you said you have not slept through the night.
Probably in 20 years. Probably 20 years. I don't remember what a good night's sleep was until I started coming to you. Within a couple of weeks, like you said, I started sleeping through the night. I mean, I know I have bags today, but when I came to you, my eyes were just black all the way down to here. And they're not anymore. So it's been truly a miracle for me.
Awesome. So
I know that I had a few visits in a row to start out, and then the one day that I didn't have a visit, I was bummed out that I wasn't coming in. And then I was really looking forward to the next visit. And I think I've had 8 visits, and I've lessened my dosage of pain meds, and I definitely feel more relaxed, and I've got more
think about it.
mobility.
2.5 weeks.
Yeah,
That's awesome.
I've had a lot of pains at different spots, and a lot of them have subsided some. And it's the main ones are still being worked on, and I do have hope now,
Oh, yes.
And that's why I wanted you guys to meet.
Yes,
Because,
it was really great.
know,
You have a
Good
lot of
story.
hope.
It's awesome.
Because, I mean, with Donna, I know, it's one of those things, like, I watched your video. You had done a testimonial video.
Right.
And I think all the staff were, bawling. Because, we know we can help. But
Right.
when it comes from a patient that's been there and experienced it and what a
Right.
difference we can make, that's what's, it's just touching to us, too, and
Right.
heartwarming. Because we know there is hope out there. And there's options and there's choice. Because, I know you drive a ways to get to my office, too.
Yes.
And you're still making that commitment and still feeling better and better and better.
Yep.
So,
Yes.
and then tell the audience some other different things, because you had a lot of really random different symptoms.
A
too.
lot of symptoms caused by just what were nerves. I even have a froggy voice today, which could actually be from that. I've had that a lot. I couldn't swallow, had problems swallowing, my stomach would tighten up. I still can't sing after having the surgery, but that might come back. We don't know. We're still
working
working. And I can't think of all the things. My ears would hiss so bad that I have slept in front of a fan forever. I can't remember not sleeping in front of a fan.
Because you slept in front of the fan because of the noise.
Because of the hissing in my noise, because in my ears, because I couldn't go to sleep. Stress was the same thing. I either couldn't shut the mind off to go to sleep, or in the middle of the night I'd wake up because I'd be in pain. Then I'd be flapping and flipping and flapping and flipping because I couldn't find a comfortable place to sleep in. So.
And then I know you said this is a really stressful period in your life right now.
Yes.
So like this
Don't know
last
my
week.
future.
Yeah. And you've even noticed a huge difference in that too, with getting adjusted and the stress calming down when it should be super sky high, right?
Right. Well,
Okay.
the nerves, again, I think it comes from the neck, and like I was feeling it all the way down my arms, and I've been waking up in the morning with less numbness, and makes a big difference to be able to wake up and be able to get up. And I was terrified, chiropractor, thinking, oh, somebody's going to crank my head and twist my back, and it's such a nice, gentle, relaxing.
Well, I do have to say, like I had interviewed a different chronic pain person to come on the show, and everything was great, and we were talking, and he's a big time sufferer. And then he told me when I said, "Oh, about chiropractic," he was like, "Whoa, I would never go to a chiropractor." And I was like, it made me realize, like, okay, here's someone who's living his life and choosing to live his life in pain, because that's his choice not to ever see a chiropractor. And I said, first of all, you don't know what I do.
Right.
You don't know anything about the technique that we use and how different it is. But he wasn't even willing to try it. He wasn't even willing to give it a chance or look at it or come into the office. And, he could be sitting there. He could be sitting in your place right now with hope. And
you have
he chose
to have a
not to have
positive
it.
attitude. Right. You have to have that want to feel better attitude.
Right. Yeah, and that's a choice too.
I think too, if more people had the experience I had, where my niece was bringing her little one. I mean, if a 3-year-old can come and tolerate it and think it's just the greatest thing to come to a chiropractor, I know, they'd be more apt to take a chance. And I'm glad I took the chance.
Good. I am glad too. Awesome. Okay. So anything else that you would like to say if you are sitting with someone that has chronic pain, what would you say to them?
You have to at least give it a try. Go and do it. You can't possibly realize what the results will be unless you go and try it. I can tell you that you need to go try it.
Got to feel it.
You really do.
KST.
What would you say, TJ?
Same thing. Got to feel it. KST. I didn't have any idea, what it was going to be about, and wasn't all that sure about it at first. But after a few visits, I really did feel the stress reduction, and I would highly recommend it for people with even if they're not in intense pain, just minor stress or just needing to learn how to relax, and
well,
it's very helpful.
Great.
I want to thank you both for coming on and talking about your experiences. I really appreciate it.
Thank you.
No problem.
Thank you very much. So,
thank you.
I'd like to thank my guests for joining me today, and I hope that we've been able to inspire you with new ideas and suggestions. I encourage you to do some research, whether you find information on the internet or at your local bookstore. It's worth your time. My goal on the show is to provide you with the information, insight, experience, and the motivation that will allow you to feel better and put you on the path to living well naturally. I'm Dr. Anna Saylor, and thank you for watching.